Hi everybody, welcome to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today. We are going to be covering gastrointestinal or GI questions today. If you're new to these drill sets, what you can expect is we'll pull up a question, I'll read it to you guys, give you about 30 seconds to answer, then we will walk through why the correct answer is right. We have Nurse Samantha moderating the chat for us today, so if you have any questions or want to say hello, be sure and drop those in the chat. Use the chat to answer the questions as well. As always, we hope you'll follow us on your favorite social channel. We have a good variety of questions we're going to get through today. With that being said, let's just go ahead and jump in and get started. All right, question 1. The nurse is caring for assigned clients. The nurse should first assess the client who has option 1, decreased bowel sounds and reports yellowish green emesis. Option 2, jaundice of the sclera and reports a moderate level of anxiety. Option 3, abdominal cramping and reports 3 black stools in the past 24 hours. Option 4, an elevated lipase level and reports upper abdominal pain rated as 9 on a scale of 0 to 10. All right, 30 seconds on the clock. I'm going to go ahead and jump into the chat as well. So good to see so many of you guys here with us today. Awesome work, you guys. Be sure again and drop those answers in the chat. If you guys are just joining, we are covering gastrointestinal questions today. So we will be covering all things stomach, esophagus, intestines, all those good conditions you need to know about. But again, we're glad to have you guys with us. Use that chat to answer, and we will go ahead and pull up our correct answer. You guys did great. A lot of good answers already. All right, our correct answer on this one is going to be abdominal cramping and reports 3 black stools in the past 24 hours. You guys did awesome on that. So again, just starting with this question, what we see there is the word first is bolded. So this is going to indicate it's a priority question. So we're going to want to use some of those prioritization strategies like our ABCs. We can also go through these option choices and look at what maybe is an expected finding with the condition and what might indicate a complication. So that's exactly what we're seeing in option 3. When we see abdominal cramping and black stools together, that's going to indicate we're having some bleeding going on in our GI tract. So what we're seeing in this one is an upper GI bleed. We're going to worry about, if we're prioritizing our ABCs, GI bleeds can lead to hemorrhagic shock. We want to make sure we're addressing this complication and we're providing the right intervention. So this is our life-threatening situation we're seeing. What we see in options 1, 2, and 4, these are going to indicate kind of expected findings, what we would expect to see with these conditions. So that we're going to prioritize our finding that is indicating a complication. So good work, you guys. You did awesome on that one. Moving on to question number 2. All right, the nurse is planning care for a newly admitted client with diverticulitis. Which of the following interventions should the nurse include in the client's plan of care? Option 1, provide a high fiber diet to the client. Option 2, administer IV antibiotics as prescribed. Option 3, request an order for a tap water enema for the client. Option 4, administer IV analgesics at regularly scheduled intervals. Option 5, monitor the client's bowel movements for the presence of blood. All right, good work, you guys. Drop those answers in the chat. Again, this is a select all that applies, so we're going to have more than one right answer. One of our best tips or strategies as you go through these is to take a true-false approach to what the question is asking. So I hope that can be helpful, and we'll go ahead and walk through these. In just a little bit, I'll give you guys a little bit longer to put your answers in the chat. And again, if you guys are just joining, we're covering gastrointestinal questions today, or GI questions. As always, we hope you guys will visit us at uworldnursing.com. We have our event calendar on there and different ways you can engage with UWorld Nursing. So we hope you'll check it out and sign up for our event notifications. All right, good answers, you guys. I'm seeing a lot of 2 4s and 5s, 1 2s and 5s. A good combination of everything in there. Good work, y'all. All right, our correct answers on this one are going to be options 2, 4, and 5. So well done. So what we're seeing here is a plan of care question for a client with diverticulitis. So when we think about it, we're just going to think about what we should do for a client that has diverticulitis. So with diverticulitis, what happens is those diverticula, or those little kind of pouches that line our abdominal our intestinal wall, they can get inflamed or infected. And so that can cause a lot of pain. We can be at risk for perforation, and we need to treat it because it's an infection, and we need to make sure we're not progressing to anything worse like sepsis or something like that, systemic infection. So some of our interventions are going to definitely be IV antibiotics. Again, those little pouches have become inflamed, they've become infected, we need to treat it. We're going to use IV antibiotics too because we're experiencing kind of problems or issues with our GI tract. So we're going to kind of work around it, do IV antibiotics, kind of instead of oral. We're going to focus on IV analgesics. Again, we're having some disruption into our GI system. We, again, want to address those or give those medications IV instead of through our stomach. And then also monitoring for the presence of blood. This is that big complication. We worry about perforation. We want to make sure that we're not experiencing a further complication of diverticulitis. A high fiber diet, this one can be a little bit tricky, but what we're looking for is a low residue diet. So foods that might be high in fiber might not be low residue. So we're looking for a low residue diet for these clients, things that aren't going to get, after they're chewed, they're not going to get stuck in those pouches. So things like popcorn, that's not going to be a good food for a client with diverticulitis. Tap water enema, this is really what maybe more aligned with constipation. It's not really going to be part of the order set for a client with diverticulitis. So just a good distractor in there. Good job. I don't think I saw any threes, so good work on that one. All right, good job, you guys. Moving on. The nurse is caring for a client who has ascites and is scheduled for a paracentesis. Which of the following types of shock is the client at highest risk for developing following paracentesis? Option 1, neurogenic. Option 2, hemorrhagic. Option 3, anaphylactic. Option 4, hypovolemic. All right, good work, you guys. 30 seconds on the clock. Let us know what you guys think. Good answers, good answers. I'm seeing a lot of great answers on TikTok, so good to see so many of you guys on today. Good work, you guys. As always, we hope you guys will follow us on your favorite channel, UWorld Nursing. We have lots of great content available on demand, a lot of our lectures, more of these question drill sets. We also hope you guys will communicate with us. Let us know other topics you're interested in. We have a pretty great bank of content available that's for free for you guys, so we hope you'll check it out. All right, good work, you guys. Great answers coming through. And again, let us know too if you guys joined on Tuesday. Samantha did a great lecture on heart failure and really the mechanics of blood flow and how that translates into the manifestations of heart failure. So good work, you guys. All right, so our correct answer on this one is going to be option 4, hypovolemic. So when we see ascites, essentially what that is a fluid buildup, kind of that third spacing of fluid in our abdominal cavity. So in that peritoneal space. So a paracentesis is going to be the draining of that fluid. So a lot of times we can experience ascites with a lot of conditions that are kind of happening in that abdomen. So it can happen with anything like cirrhosis, tumors in our abdominal cavity, all sorts of other conditions. So but what happens with the paracentesis is we have a guided needle going into our peritoneal cavity. It's going to drain that fluid, but we're at risk for that hypovolemic shock when we pull too much fluid. So anything typically greater than 5 liters of fluid, that can cause that hypovolemic shock. So essentially we're pulling too much fluid and we do it too quickly, and we don't allow our fluid to kind of shift and regulate itself out into the spaces it needs to be into. And you might think 5 liters of fluid, that's insane, but you will see that more often than not. I have a background in oncology nursing. A lot of times cancer that happens in our abdominal cavity can cause ascites, and you'll drain that amount of fluid very frequently. You'll be shocked to see so much fluid come out, but it finds a way, it stays in there, and it causes complications. So definitely something you'll come across a lot in an oncology setting. But you guys did great on that one. Again, hypovolemic shock, we need to monitor these clients after to make sure their blood pressure is stable, it's not dropping, or if it's dropped, that it's raising, and that they're stable. So good work, you guys. All right. Next question. The nurse is teaching a client with chronic pancreatitis. Which of the following information should the nurse include? Select all that apply. Option 1, supplement your diet with fat-soluble vitamins daily. Option 2, limit your consumption of alcohol to 1 to 2 beverages per week. Option 3, consider participating in a smoking cessation program. Option 4, take pancreatic enzymes with every meal. Option 5, consume a low-fat diet. All right, good work, you guys. 30 seconds on the clock. Drop those answers in the chat. Again, it's a select all that apply question. We're going to have more than one right answer. So let's see what you guys think. As always, we guys hope you will join us again tomorrow. We are going to be covering most missed questions with Nurse and Coley. So we have a wide range of topics that are covered on our most missed question sets. So we'll cover some of those more challenging topics, more challenging like strategies, but make it easy for you guys. Make sure that you know how to answer those questions if you see them on the NCLEX or in nursing school. So we hope you'll come back 3 p.m. Central Time on your favorite channel. We will be there. All right, good work, you guys. I'm seeing a bunch of good answers come through. I'll go ahead and pull them, our correct answers up. So our correct answers on this one are going to be options 1, 3, 4, and 5. So again, we see in this question, chronic pancreatitis. It's a teaching question. So what we're looking for are those true statements. What is a true statement? What a client should say or what a nurse should say about this condition. So chronic pancreatitis is an inflammatory condition. It's going to cause our pancreas to become fibrotic or hardened. It's going to impair that pancreatic function. So think about things like insulin production, glucagon, digestive enzyme production. So chronic pancreatitis is most commonly caused by chronic alcohol use, but it can also be caused from biliary tract disease, autoimmune conditions, tumors, cystic fibrosis, anything like that. So clients with chronic pancreatitis, they cannot secrete lipase, so in sufficient quantities. So we need lipase to digest fats, and we're going to require oral supplementation with these pancreatic enzymes like pancreolipase. So clients need to take these pancreatic enzymes with meals and snacks, and they also need to restrict their fat. So kind of translating this to what we see in that client in this question, we need to supplement with fat-soluble vitamins. Again, we're needing to supplement some of that fat that we maybe aren't able to get in through our diet with supplementation. We need to take definitely smoking cessation. This is always true. We're never going to encourage a client to smoke or smoke a little bit. We always want to encourage them to quit smoking. We're going to need those pancreatic enzymes to break down that fat. And then also we want them to consume a low-fat diet. We need those, we need to supplement with the enzymes to break down the fat. We don't want to consume a high-fat diet. So good work on that one, you guys. You did great. All right, moving on. Next question. The nurse is caring for assigned clients. The nurse should first assess the client with option 1, cholecystitis, who has a rigid abdomen. Option 2, a bowel obstruction, who has faint bowel sounds. Option 3, cirrhosis, who is reporting amber-colored urine. Option 4, peptic ulcer disease, who is reporting epigastric pain. 30 seconds on the clock. Drop those answers in the chat. Good work today, you guys. As always, we love to ask you guys how you're studying, what resources you like, if you're using UWorld, what you love about UWorld. Let us know. Everyone studies differently, if it's whether like reviewing content, doing practice questions, watching videos, all that good stuff. So let us know how you guys like to study. We want to make sure we're addressing those needs for you guys. Good answers too, a bunch of correct answers coming through. So well done, you guys. Awesome, awesome. All right, good work. And bonus points to Stella for your reasoning on why you answered what you answered. So good work. All right, our correct answer on this one is going to be option 1, cholecystitis, who has a rigid abdomen. Again, first is going to mean this is a prioritization question. So we're going to think about our ABCs, airway, breathing, circulation, what we're finding, what condition and finding, if those match up as being kind of expected versus a complication. That's a good approach we can take to some of these questions. So what we see in option 1, cholecystitis and a rigid abdomen, anytime we see that rigid abdomen, we should be worried about peritonitis or, a rupture of something that's causing peritonitis. Essentially, that fluid in that that peritoneal cavity where it shouldn't be. We're worried about, a rupture or again, a fluid shift of anything. So cholecystitis again is going to be like an inflamed gallbladder. So this can be caused by gallstones, biliary obstruction, that's going to block our bile secretion, and that's going to cause our gallbladder to become distended. If our gallbladder becomes too distended, it can rupture. Kind of same idea as like an appendix. Anything that's putting too much pressure on it, not allowing it to function properly, can cause rupture. That rupture can cause matter and material to get into our bloodstream, into our abdominal cavity, causing sepsis, peritonitis. This is a life-threatening condition, a life-threatening situation. We need to take action. What we see in options 2, 3, and 4, these are going to be expected findings. We're going to expect to have faint bowel sounds with a bowel obstruction. We can expect to have some changes in our urine color and cirrhosis. And then same idea, we can have some discomfort when we have peptic ulcer disease. Think about that kind of accumulation of acid or ulcers in our stomach. So again, good work on that one, guys. Well done. Okay, next question. The nurse is observing a staff member caring for a client with gastroesophageal reflux disease or GERD. The nurse should intervene if the staff member is observed. Option 1, requesting a low-fat diet for the client. Option 2, encouraging the client to eat small, frequent meals. Option 3, placing the client in the supine position after the client eats breakfast. Option 4, administering a proton pump inhibitor to the client 30 minutes before dinner. All right, good work, you guys. Awesome, awesome. Let us know what you think. Again, this is an intervene question. So when you see intervene, the correct answer is going to be the incorrect action. So I hope that's helpful. We also want to take this time to kind of say thank you and recognize the National Student Nurse Association. So a big thank you to the NSNA for selecting UWorld to be the exclusive provider of NCLEX prep services. We are so thankful to be partnered with them. We just had a press release go out yesterday kind of talking more about our partnership, but we are really thankful to be partnered with them. We have a lot of exciting content coming ahead in partnership with them. So a big thank you again to NSNA. Awesome, awesome. All right, good answers, you guys. I'm seeing a bunch of correct answers, and so good to see so many of you guys on here today. If you haven't, be sure and follow us on all of our channels on your favorite type of channel. But we're so glad to have you guys with us. All right, so our correct answer on this one is going to be option 3, placing the client in the supine position after the client eats breakfast. So again, we talked about this. This question says intervene. So be sure and slow down, read the question, see what it's asking us. But again, so intervene means our correct answer is going to be the incorrect action. So when we have GERD, essentially you can just think about, it's kind of in the name, reflux, like a regurgitation of that acid in our stomach up through our esophagus. It's going to cause some deterioration, some pain, discomfort, burning in our esophagus. So again, things we should do for these clients are what we're seeing in options 1, 2, and 4. But what we shouldn't do is lay down flat after eating. So again, we really want to stay upright. We don't want to lay down really at all. But if we have to be in a bed, we want to be upright. Think about gravity. We want to keep that kind of gravitational pull on our stomach contents, our stomach acid in our stomach. If we lay flat, you can kind of just think about fluid spreading out. We don't want that acid to go back into our esophagus. So that would be something we would intervene on. So good work. You guys did great on that one. All right, next question. The nurse has taught a client with peptic ulcer disease who has a new prescription for omeprazole. Which of the following statements by the client would require follow-up? Option 1, I should take the medication daily after eating breakfast. Option 2, I will notify my healthcare provider if I experience diarrhea. Option 3, I may take the medication at the same time as my beta blocker. Option 4, I should take acetaminophen instead of ibuprofen if I am experiencing pain. All right, 30 seconds on the clock. Let us know what you guys think. Also, too, let us know if you guys are getting ready to take your NCLEX. If you've taken it and you've gotten those glorious word of past. We want to celebrate you guys. So be sure if you share anything on social media and UWorld was part of your kind of study toolkit, we'd love to celebrate with you. So be sure and tag us. And also let us know too, if you go to uworldnursing.com, we have a great place you can share kind of a testimonial study tips for it with other nurses too. So check that out. All right, good work, you guys. Okay, I'm seeing a bunch of right answers. Well done. So our correct answer on this one is going to be option 1, requires follow-up. Option 1 requires follow-up. That's not the right answer. Option 1, I should take the medication daily after eating breakfast. This is the action we're going to need to intervene on. This is what requires follow-up. So when we are talking about omeprazole, we're talking about a proton pump inhibitor. So this is really in kind of what it does is in the name. So the proton pumps in our stomach are what secrete the acids. So these medications go in and they inhibit that production of acid. That's going to decrease how much we release, decrease how much is circulating in our stomach, and help, kind of help with those healing of ulcers or discomfort, pain that's happening in our stomach. So when we have less circulating acid, we're going to increase that pH in our stomach and get it into a more neutral, our stomach can never really be neutral, but we want it to be acidic so we can break down food, but getting it to where it needs to be so it's not too acidic. But when we're talking about these medications, they need to be taken in advance of eating food. So that's why we would intervene on this option. We want to take them usually at least 30 to 60 minutes before eating so that they can do what they're designed to do, inhibit those proton pumps. We don't want to take them after. We want to inhibit them before they can work, essentially. Option 2, just kind of walking through these other ones, I will notify the healthcare provider if I experience diarrhea. So if our stomach doesn't have enough acid in it, it's not going to kill the bacteria it needs to kill. So we want to make sure if we are experiencing diarrhea that we haven't kind of over-neutralized our stomach and those bacteria are flourishing more than they should. So things like C. diff. We can take this medication at the same time as a beta blocker. It's not going to interfere. And then you can take acetaminophen. You would want to take acetaminophen over ibuprofen. Again, ibuprofen is an NSAID that can cause bleeding. We don't want to exacerbate any risk factors for a GI bleed. So you guys did great. Well done. Okay, next question. The nurse is caring for a client with constipation. Which of the following snacks would be appropriate to offer the client? Option 1, graham crackers with peanut butter. Option 2, bran cereal with raspberries. Option 2, bagel with cream cheese. Option 4, yogurt with honey. Let us know what you guys think. Good work, you guys. Again, this is a diet question related to constipation. Good work, good work. Let's see what you guys think. Awesome. Again, we hope you guys will visit us at uworldnursing.com. We have our event calendar on there. You can subscribe to, get notifications, as well as great links to kind of welcome you into the UWorld Nursing community. We have information about our subscriptions, information about our free trial, and other just great information about the NCLEX itself. So we hope you'll check it out. All right, you guys did great. I'm seeing a lot of correct answers. Well done. So our correct answer on this one is going to be bran cereal and raspberries. So when we're talking about constipation, what we're looking for is a high fiber diet. So we also want to increase our fluid intake. That's going to be a big fix for constipation, but we also want to encourage a high fiber diet. So that's bran cereal and raspberries. Those are going to be our 2 high fiber foods. Whenever we're answering a question, we need to make sure both things really satisfy what would make the answer correct. So what we might see, what we see in option 1, this is maybe a little bit more of like a high protein option. Option 2, a bagel and cream cheese. The cream cheese is not going to do us any good for constipation. And same idea with yogurt, that dairy is going to help, or is going to kind of exacerbate some constipation. So bran cereal, high in fiber, raspberries, high in fiber. Good work, you guys. All right, that leads us to the end. That was our last question. Thank you guys so much for joining. As always, come back tomorrow, 3 p.m. Central Time. We'll be doing most missed questions, covering a bunch of great content with Nurse and Coley. Thank you guys for joining today. Check us out at UWorld Nursing, and we'll see you next time. Bye.